There's always challenges. Some of the big ones I think that we need to tackle industry-wide is just helping patients understand how to navigate healthcare. And that's no longer just paying a bill or booking an appointment, but their whole care journey. How are they going to be involved throughout? How can we reduce the stress and anxiety when patients need medical treatment so that they're not thinking about how am I going to pay this bill, but rather, oh, I see I've got this scheduled treatment plan and they've offered me a payment plan to take care of my out-of-pocket over months. And that I think can help patients focus on their healing, which, that's how it really should be.
Welcome to Revenue Cycle Above the Bottom Line, the podcast where we dive deep into the world of revenue cycle management. I'm your host, Tim Reiner, and in each episode, we sit down with industry leaders, innovators, and experts to explore challenges and strategies shaping the future of healthcare revenue cycle. Whether you're a seasoned professional or just starting out in the field, this podcast is your space for thought-provoking conversations, actionable career learnings, and discussions about the latest trends you need to know about. Thanks for tuning in, and let's get started. We have a really special episode today. I'm virtually joined here in the studio with Keresztes, software developer at Epic, and Ryan Krause, revenue cycle product informatics at Epic. Hello to both of you, and thanks for being on the podcast today. Why don't we start with a quick introduction? Alex, let's start with you. Tell me a little bit about yourself and your background and how you kind of started at Epic. What's your origin story, so to speak?
I'm originally from Brazil. I went to school there for quite a bit of time. When I went to college, I kind of came to college in the U.S. and kind of was doing math and kind of learned a little bit about the small company in Wisconsin at the time. I had worked at Apple a little bit, was interviewing a couple of different areas here and kind of learned about kind of this group in healthcare. Came up here, really learned a bit about what the company was doing, and it really matched with kind of some of the things that I was interested in, both on kind of making a difference, as well as kind of controlling and being able to directly solve problems and change and create software on its own. So it kind of led me here to this space, and my wife is also from the Wisconsin area, so it kind of naturally was a good fit for me at the time.
And what about you, Ryan? What was your kind of origin story getting into healthcare and starting out at Epic?
I've been here now 21 years and have really never looked back. I started out in implementation back in 2004, and I remember getting a call from when you start at Epic, you're assigned a mentor. And that's your person, helps you assimilate into your role and understand Epic. And so Carrie, who was mine, she called me and I was really excited. I was like, I'm going to be working in healthcare, such a different thing than I was trained for in college. And I asked her what team I was assigned to. And she's like, oh, well, the billing team, of course. You're a finance guy. So I joined the very young hospital billing team at the time. I think we were a combined team across hospital billing and registration and ADT. And we maybe had 10 people that were in implementation like me. And it was a pretty steep learning curve. I think a lot of people can relate to going to the doctor's office, right? If you get assigned to the ambulatory team, you know what that's like. But I don't think anybody really knows what the inner workings of a billing office look like. So it was a lot to learn, but man, I've been with it ever since, just like Alex.
So Alex, I think it's fascinating that you've been a software developer with one company for so long. I think that's a bit unique, like in this kind of world today where startups and folks seem to move around in engineering. Were you assigned a mentor, and were there some things that you took from some of those early mentors that have kind of created that lasting career at Epic?
Like Ryan said, all of us here when we first start, we kind of get a mentor that really is helping guide you and shape you and so forth. I've really always appreciated here at Epic, the people that we work with are amazing, and they have been part of what makes the company so special. And also, that's what kind of keeps you at your jobs and kind of the areas that you're focused on. I think that for sure, as well as the challenges that we are continuing to solve. I am yet to find, that I'm bored and trying to do what I'm trying to do as far as solving new problems. I feel like the problems continued to get harder over time. And, there's been a lot of growth kind of needed in order to accomplish that. And kind of learning from, our customers, organizations like you, Tim, and different groups kind of is really part of that growth as well, of really becoming experts in the domain. So I feel like I've never been bored of learning, always continuously learning. And the people that we work with here are kind of amazing that kind of continue to challenge that. But I've definitely been able to focus in a couple of different spaces as I've kind of been here throughout my career. And kind of that change internally has kind of still kept things exciting, whether it's focusing on the patient experience or automation or kind of different areas of the revenue cycle.
Well, this next question is kind of for probably a little bit of both of you. Can you walk me through the history of how Epic got into billing? I understand it was like professional billing first, and then kind of scaled into hospital billing. And I think both of you were around for that evolution. What's the history like there, and like what were some of the lessons learned along the way?
So Epic was founded, in 1979, and back then, I think all of the IT that was out there in healthcare was either for lab or billing. And Epic started as a clinical system, actually in the ambulatory care space, which a lot of people think of us primarily as a hospital vendor, but we started out as ambulatory and clinical. And over the years, based on what customers were asking for, we would do more and more and grow what Epic offered. And I wasn't around for the initial ask, but the way that Judy tells it, our customer said, well, we'd also love to have integrated billing. It's pretty easy. You just tally up the charges and you figure out what the payment is, and whatever's left goes to the patient. That's about it. And so we said, okay, we can do that. Turned out that it was a lot more complex than that. And I don't think anybody would say that billing is easy, but it was pretty well defined. One of the advantages I think that our customers have is that we actually did start as a clinical system, which is the superset of information about a patient. And when we added billing later, it was the byproduct of all of that, the clinical care that was provided. And we had that benefit of not having to try to take what was a billing system and try to make it a clinical system.
I think we always talk about the patient at the center of all we do. Mm-hmm. And because of the things that Ryan mentioned in the background, that kind of formulated a lot of what we did in revenue cycle as well, where other systems had been very episodic and information is copying, around that time was kind of when we kind of created hospital billing. And that single registration, a single record around the patient at the center was really a core, and it's kind of different perspective than what most groups were doing at the time. And it's kind of been a pretty big differentiator for us as far as kind of keeping the patient in focus and everything around the patient.
What do you think's kind of kept you at Epic as well? Alex has had a long career. You've worked there a long time as well. You described like the people, so I know that's one of the aspects. Yeah. But what are some of the other aspects that your day-to-day, is made fun?
We've been fortunate to have to figure out things to help support our customers here in the States. We've had to learn about some of the markets overseas and what they need in those markets, and how some of that can be brought back into how we develop the software for the groups that use it here in the US. So it's just been a fascinating job. It's been a fascinating company. We have a lot of great things that keep us here on campus, and it's just a fun place to be.
One thing to add is just like, the culture here is, definitely kind of amazing part of what we do. And even at the development level and the development role itself, most companies, I've worked in some other areas before, kind of coming here, intern, at Apple, as kind of mentioned before. And other areas, you have folks that do the specification, folks that talk to the consumers, doing the market research and doing the understanding. But here, really, we, as a developer, are responsible for kind of a lot more than what is done at a traditional kind of software development company. And we're not just programming a spec. And that is really unique, which makes it hard. It means people need to be really smart to kind of work here and make it work and really understand problems, and not just the coding aspects of it, but kind of like how do we go about solving some of those unique situations. But really also drives people to kind of make a bigger impact and moving things forward. So I think that's definitely a unique piece of kind of the role here at Epic that isn't quite as widely known.
Now, you talked a little bit about connecting with clients. I think that's been one of Epic's successes is, doing some things like we've actually done in the past is, embedding, coming and seeing the actual workflows. Are there some differences that you've noticed between clients, either domestically or abroad, internationally, that, are lessons that you've learned over the years?
It's hard to innovate in all areas or excel in all areas. And so when we go and do immersion, I really like to go to the areas where, where are we not taking advantage of everything that is possible, but then others that are kind of pushing the envelope as well to kind of continue to drive the product and the areas kind of continue to move forward. A lot of what we do is coming from the immersions. Let me talk a little bit about that, Tim, just to kind of for folks that may not know. We have developers that go and do two things. One is shadow users directly in what they're doing in their system. That means sitting side by side, seeing what they're doing, try to figure out how they can make their workflows better and solve those kind of problems. And then we also do quite a bit of shadowing and discussions with thought leaders of like, what's keeping you up at night? What are your big problems? What are the solutions that you hope that we could help you with, and continue to post on those envelopes? Both those kinds of immersions really drive us, and they've kind of driven kind of software changes. And the thing that I think is the most helpful is that we get a couple of things. One is deep expertise on those areas. We've been working on a couple of different areas with AI. We'll talk a little bit about that later, but really becoming experts in that space, and kind of really shadowing the users is the way to kind of do some of that. And then the second piece is when folks come back and they come back from these immersions, they realize the potential that the development has, and they come with an urgency of getting things done and really helping others. That kind of drives that kind of that software forward quickly in a fast way. So I really think it's one of our most important things that we do to both understand what we should be doing as well as kind of moving on it quickly.
Do work with almost all of the customers that are interested in Epic, or all the groups that are interested in Epic and before they join. So part of my role is to show them the capabilities of the software. But what I love about those interactions is that's when the folks that are in the audience share a lot of their hopes and dreams, what they want the software to be doing from a revenue cycle standpoint. And a lot of it we have because we've developed it over the years based on feedback from customers and what we learn in immersions. But coming back from those things and hearing really cool ideas, sharing them with Alex and the development team, and figuring out how, which of those should we invest in and do some development to make sure that we can help the community continue to thrive.
How do you go through a systematic process to ensure your roadmap is kind of keeping up with all the various changes, and both regulatory changes and like your customers' needs? There's like thousands of things customers have problems with, probably. In revenue cycles, certainly, there's always no shortage of problems to fix. But how do you kind of take all that feedback in and distill it down to things that make it onto your roadmap?
Yeah, I think there are a couple areas. One is we definitely have some big areas of focus. When you talk to you, Tim, we talk to other groups, areas that you would like us to really focus on and continue to make your organizations world-class and kind of moving to the next step. Areas like the patient experience. How do we make the patient the best that they can? Automation and AI, analytics, and continue to push in those different spaces. Those are kind of the big kind of areas, and we use quite a bit of the community to figure out what are the big areas that we should be focusing on. And then from there, we work with the community to try to figure out, okay, what are the most important pieces in those areas that you would like us to tackle on next? We have some approaches that are systematic, the focus groups. There's some processes where organizations can share their ideas with us and do some voting and some of that to kind of help us understand where the priority should be. But there's a lot of it that just happens through some of those informal discussions and kind of direct communication with different organizations to get onto the roadmap. The other piece, I think, is we're always monitoring what is available with new technology, especially right now with AI and the advancements in that space and what's been happening so quickly. there's problems that weren't solvable before that are able to be solved now. And we really need to be good stewards of technology as a company. And so we're also, just like we prioritize based on kind of all the needs of the organizations, we take a look at the technology that has become available and how does it open it up and make it possible to solve problems that weren't able to be solved before. I think that's kind of another piece that we're always continuing to look at.
Ryan, how does your role kind of layer on top? Like Alex is focused on kind of the roadmap and the R&D.
Yep.
You know, your role is to kind of engage with clients a bit more. Like how do you kind of connect in with that mission?
It's absolutely, a collaboration because what I work with our sales team. We've got a very small sales team for the whole world. 7 people in total do sales, and they'll take me and a number of other people on the road, and we'll be showing the software. And again, feedback that we get in those types of situations when people are looking to make a change is a little bit different than the feedback of when they've been using Epic for a while and they're used to it and they wish it would do X, Y, and Z. So bringing those two perspectives together, and oftentimes, of course, that involves bringing in Alex and other folks from research and development, especially when we need, if we're looking at perhaps going into a global market, into a different country, we want to make sure that we've got the software developers alongside the folks that are showing the software and listening to the customer. And so that collaboration, we are able, I think, to really advance the product and put something out there that meets the needs of our customers today, but also those in the future.
Sometimes when you talk to someone, they'll ask about what can help them today. So we'll go on immersion, I've shadowed users doing customer service, and they say, hey, make this easier so I can make that call faster. One example is like, how can I produce a HSA or FSA reimbursement? It's kind of a common request. We've done things over time to kind of do that. If we only focus on those immersions and those ideas, that's what we would do. But really the root of the problem is, or a root of some of what we can help is to say, well, why are we taking these calls? How can we help patients do it on their own? And that actually is something that has become available recently. And I've seen some numbers of organizations that just recently upgraded to those versions. There's like 7,000 patients a day at some organizations, getting these receipts online. That's 350 hours. That's, a lot of people and calls that you're saving. So not just focusing on the things that we can do based on requests, but trying to get at, hey, what's the root problem? And Ryan's perspective is, we need to understand what are some of these bigger challenges and kind of bringing those outside perspectives and how do we solve those other bigger problems.
A good example of that, probably maybe a year and a half ago now, I was definitely getting the sense when I was talking to prospective customers that they were really overburdened by a lot of coders, especially on the physician billing side. And we said, well, is there something that we can do better? And so we engaged some of the development team and got on site with a lot of different groups, sat side by side, and we had this new generative AI feature this tool that we could use, and coding was a great space to look at. The clinical documentation is free text. So in the past, free text mostly needed somebody to look at it, or you'd send data out to a third-party system and pay somebody else to crunch it and maybe send some codes back. But we revamped the professional billing coding workspace about a year ago, incorporating generative AI to read through the free text documentation and married up with the discrete documentation as well to really give the coders a big assist. And that was sort of sniffing out a problem before it became a big problem. And then, over the past year, there's been a lot of vendors that have come out with Gen AI coding solutions. Ours is native, it's built in. And the feedback that we've gotten from the community, the first few groups that have rolled that out, they gave us a lot of feedback on how to continue to make it better, but the lot of positive feedback from the coders saying that it saves them tons of time. And so that's an exciting thing to see. Solutions that we come up with collaboratively really start to make that impact.
What are some of the key challenges you think are facing, like large organizations like AdventHealth that has, a lot of hospital billing and physician billing integrated in that activity in one system? You mentioned coding is one, and there's a challenge we talked about earlier of the the patient bill and the portions, the ever-growing, kind of debtor, we're basically extending credit to consumers as health systems. Are there some other key challenges that we face, do you think?
I mean, I think there's always challenges. Some of the big ones I think that we need to tackle industry-wide is just helping patients understand how to navigate healthcare.
Yeah.
And that's no longer just paying a bill or booking an appointment, but their whole care journey. How are they going to be involved throughout? How can we reduce the stress and anxiety when patients need medical treatment, so that they're not thinking about how am I going to pay this bill, but rather, oh, I see I've got this scheduled treatment plan and they've offered me a payment plan to take care of my out-of-pocket over months. And that I think can help patients focus on their healing, which, that's how it really should be. Healthcare, unfortunately, is not free in the US, but what drives us is making sure that it's a good experience for patients. Nobody loves to pay a bill. That's just, I don't like paying bills. I have to do it, but I don't love it. But if we can make it convenient, we can make it understandable, I think that goes a long way to demystifying the whole healthcare journey for patients.
Before we continue, we wanted to thank you for tuning in. If you have questions or thoughts or just want to say hi, we'd love to hear from you. Send us an email at revcyclepodcast@adventhealth.com. That is REVCYCLE podcast@adventhealth.com. If you enjoyed this episode so far, be sure to like, subscribe, or follow so you never miss a new episode release. Now, let's get back to the rest of the episode. What are some other applications of either automation or AI that kind of are exciting to you that you can leverage this electronic medical record that we've got and, kind of take it to the next level?
The key thing with AI that right now is that really it's enabling users to do their work more efficiently and quickly. It's like Ryan mentioned with kind of the coding space. One of the folks was on a call earlier today on the physician coding. They said it elevated their physician coding experience just by having that physician assistance. Another space that we've been working on is how can we better support really trying to take the right decision making and kind of enhance that with users. So things like with appeal for denials, what are the medical policies and procedures from the payer? How well does this case really meet those medical policies? And then if it does, can we help assist with that process and kind of make it fast and easy for users? So some of that just wasn't possible until the most recent technologies that have come out to be able to read text, read the medical policies and ingest them and load them into the system. Be able to understand, does the notes meet those medical policies and some of those things? You'll hear a lot of buzz in the industry on agentic AI, from NVIDIA and others, and, multi-agents. And, some of these areas that we've been looking at, coding, denials, and a couple of the areas, really building these agents that will be able to help either, if there's clear-cut cases, take some of that medical, some of the, justification and saying, hey, this case is a clear-cut, you should just, take this action, elevate that to the next level. That's pretty exciting stuff for me. And then really allow users to focus on the areas where they need their attention, take away the kind of the easy or, kind of cases away. And as AI continues to get better, it's kind of continue to go at a somewhat exponential kind of curve right now. Those things will really become a lot of possibilities there to be able to kind of really increase the outcomes.
So Ryan, as you think about the future, how do we still strike that balance, like even within an organization like mine, where I have to serve like a really large kind of academic institution and something that's really small and rural, those sort of exist like within the continuum that I have to think about too. Is there kind of anything we can kind of take to make sure it works in all of those settings?
Yeah, I mean, that's most of what we develop, I think, here across the board at Epic really is applicable to both large academic medical centers and, small rural healthcare centers. You think about things like, the patient financial experience and these things and the coding denials. All of healthcare has to deal with that, whether you're a large academic medical center or you're a QHC. There's obviously regulatory things that come into play for places like, I think of rural health clinics, I think is what I'm thinking of, or no, community critical access hospitals, right? That's one where I think one of the benefits of Epic in general there is there's 3 or 4 beds at a critical access hospital, right? And they can be reimbursed separately if the patient comes in an emergent situation, but then they need to care for them as inpatient. In most of the world that isn't Epic, that's a discharge and a readmit. Orders get discontinued, they have to reorder things. It's a very big burden on the clinician, even if it's at the small facility. And in Epic, that's just a single episode. We split out the billing behind the scenes. So just, and then that they don't have to discontinue the medications and the orders and all those things. So just one, example of how the software that we develop, even though people think that we work with mostly the larger organizations, a large portion of the Epic community is those smaller groups. Long-term care is increasingly under the umbrella of Epic as well. So we have to keep an eye on all the regulatory pieces, but then make sure that the solutions we develop will scale to the large ones, but also be usable by the small health systems. I think the biggest difference that I see is typically the smaller hospitals, they don't have the same IT resources to roll out a lot of the new features. So we take that very seriously here at Epic, and we have a few initiatives. For many years, we've had an acronym here that we say we use DUET, which stands for difficult for us, easy for them. Them being you all, the healthcare providers. So, just one example of that is when we did the interpreted claim status a few years back, and there are thousands of claim statuses that come back when you check on the status of a claim, different permutations of codes that can come from the payers, and we distilled it down to 15 unique statuses, 5 of which require follow-up and 10 of which don't. So we're trying to eliminate the need for things like follow-up work queues, whether you're in a small critical access hospital or if you're working in a large academic medical center. We also have an initiative here we call As Easier, Easier. So with each release of the software, we're trying to reduce the burden it is to keep up to date with new features that we develop and make sure that things are on by default so that IT doesn't have to do a lot of configuration. We tried to move a lot of the operations staff to be able to make changes in the system without having to go through IT, making updates to dashboards, using Slicer Dicer for deep analytics, and even offering classes here at Epic so that revenue cycle operations managers, directors, VPs of rev cycle can come to Epic and learn how to use our analytics tools in their own system while they're learning in classroom, so that they're looking at their actual data, and then they're taking what they learn in classroom and really making it to muscle memory right away. So that really doesn't matter if you're at a small hospital or you're at a large one. You still have to do those things.
The patient experience from start to finish, that journey, that navigation that we talked about a few minutes ago is really important in healthcare. How does technology have an ability to kind of improve that process of, patient engagement? There's various things you can do with communications, omnichannel communications, but what other technologies can we bring to bear? Maybe some AI, automation?
There are a lot of elements that make a great financial experience. I think one of them, even though it's not quite as sexy, is no surprise bills, right? Yeah. Are you aware of what is going to happen in this visit? What it might potentially cost you. You don't want to just get a bill after the fact, and kind of be surprised by that. That is something that, even though the government has been kind of pushing towards that lately, we started on that journey back in 2012, I think. 2010. Yeah. With patient estimates, and it's kind of a foundation of a lot of what we do. But continue to provide accurate, upfront transparency to patients, because then they can plan for it and kind of doing that. The other piece, I think we talked a little bit, it was how we can provide convenient options to patients, through the personalized approach that makes sense to them. Yeah. So if I am in a family of 5 and based on my income levels, I see, payment options that make sense for me, and being able to set up a payment plan and kind of some of those things and kind of know that I'll be okay for my kind of overall healthcare. I can take that away as long as I'm able to kind of make, some kind of pieces there, or that there are financial assistance options, and to kind of continue to get that personalized experience as part of it. And then the other piece continues to be digital. So we want to make sure all patients can certainly get communicated with, but the newer folks definitely want to interact in the way that makes most sense for them. My daughter, is using cell phones and so forth, and others, want to still receive the paper statement. Getting that right approach to the right person, engaging with them through those various channels of communication is definitely kind of the other piece. And I think there's a lot available there. I think it's a lot of organizations, there are opportunities to take advantage of what is becoming available, and kind of really pushing that forward to kind of make that journey great. The other piece that you mentioned, Tim, on rural clinics, and kind of with Ryan and some of the needs, we do see some needs sometimes that there's less staff in those areas, and areas like being able to meet the patient where they're at, with whether it's like the kiosk or taking on a larger role, or something like a tele-reg, where you might not have enough people to really kind of, be able to do all those pieces, but letting the patients do as much as possible on their own. And if they need help, having additional options to engage digitally or kind of with a quick call or video conference with a person to help them get through the next pieces is also another way to continue to elevate it. And we're continuing to look at ways to use AI in this space, to mostly help patients understand why they owe what they owe, feeling comfortable that things are accurate and make sense, and there's no surprises.
So we're on a journey here at AdventHealth to move from what we've called a world-class revenue cycle to becoming preeminent. I try to tease out this question with each of my guests. So from each of your perspectives, what do you think of when you think of preeminent?
A few things that come to mind for me, certainly being a thought leader, knowing that the challenges of the industry, going out there, attending conferences, you can get a lot of perspective there, and then seeing groups that are able to execute deeply on solving those challenges, I think is what elevates people to a preeminent status. Keeping in mind that the patient is really at the center of this. I can name a number of organizations where that really does drive almost everything that they do. And if you kind of center around that, and if you can make it a great experience for the patient from the point that they need access to your health system until the point that they get that bill, and they don't feel frustrated at all, or they're not, and they understand their whole journey, I think that really does elevate an organization to be the place that patients want to go to.
Yeah, I think there's generally three things, and I think Ryan hit the first one on the head, that great patient financial experience and be able to do those things. I think the second one is adoption of technology and kind of being able to quickly move forward is the difference between an organization that is really meeting folks and solving those challenges quickly, versus someone who is just, discussing and kind of moving there. So that moves it to preeminence, kind of be able to do that. I think the third thing that I would say right now in the space is, like, we are definitely seeing an evolution, I would say, of the business office. A lot of what has been done historically has been managing people and focused on, okay, this is the work that needs to be done. Are folks doing their jobs? Are they working it? And I think the preeminent organizations right now need to start to figure out, how do I adapt that billing office to kind of change the overall revenue cycle. So it's not just about managing the work, but like, how do I, change the work that's being done? How do I use analytics to understand where the work is coming from, to be able to work either things in mass or kind of start finding root causes and problems and kind of changing kind of the way that things are done. So the organizations that are more able to use analytics and kind of adapt to the virtual billing office, we're kind of doing some of those things to try to help with that, with the rev cycle informatics and so forth, are really going to be at the next level as far as being able to adapt to kind of some of these changes. And I think it's something that the industry needs to do.
Yeah, we've had a chance to talk about a lot. If there's one key takeaway that you would want to give as advice to revenue cycle leaders, what would that be? Alex, I'll let you start. What should rev cycle leaders be focused on in the next couple of years?
Focus on the areas that we're just talking about now about the preeminence, as far as how do you change your business, how do you understand what's going on, and kind of look at adopting things, accelerating kind of some of that adoption. I think that is probably the biggest thing, and accelerating that change that needs to happen within your organization.
Well, Alex and Ryan, thanks so much for joining me today. I've really enjoyed our conversation, and I'm excited for the future and what it has to hold for both of our organizations. Thank you so much for tuning in to today's episode, and make sure to like and subscribe to be notified when our next episode drops, and we'll see you next time.